Welcome back to Ask Allison. Here is today's question. I started my private practice a year ago. However, I'm nowhere near full despite many coffee dates, networking events, usually a monthly event that I put on. I was talking to another therapist who also lives in the area, and our theory is that our area is a really saturated market for therapists. Herein lies my topic suggestion: what to do and not do when you're building a private practice in a saturated market. Ooh, I love this question. Okay, first, I want to thank Therapy Notes for sponsoring Ask Allison. They are the #1 rated electronic health record system available today with live telephone support 7 days a week. It's clear why Therapy Notes is rated 4.9 out of 5 stars on Trustpilot and has a 5-star rating on Google. Therapy Notes makes billing, scheduling, note-taking, and telehealth incredibly easy, and they also offer e-prescribe for you prescribers out there. If you're coming from another EHR, Therapy Notes makes the transition incredibly easy, importing your demographic data free of charge so you can get going right away. Find out what more than 100,000 mental health professionals already know. Use promo code ABUNDANT at therapynotes.com for 2 free months. All right. A saturated market is a much better place to build in than an unsaturated market, even though it may not feel like it right now. If I had a choice to start a private practice in low, mid, or high saturation, I would choose high saturation every single time. And that's because where there's a higher therapist saturation, there's highest client saturation. So in a saturated market, you do need to stand out. Your niche needs to be super clear. You need to talk about your niche in the way only you can talk about your niche. You and I could have the same niche, same values, same modality, but we're different people. So you have to bring your own personhood into your marketing. Networking is really great, but you need a more comprehensive marketing strategy than that. Without knowing your niche, I'll also say that networking with other therapists who aren't full isn't the most effective way to network. So I'll give you an example. If you work with overwhelmed moms, struggling with the mental load and work and parenting and partnering, then you're specializing in clients that most clinicians feel competent and comfortable helping. If that person calls a therapist who specializes in anxiety, for instance, that therapist isn't likely to refer them out because they're still within their wheelhouse. Conversely, if a client calls me for help with substance abuse issues, I'm going to refer them out because I don't feel like I'm the best fit for them. And that doesn't mean you should change your niche. Instead, you choose your marketing. Using my example, make sure your website is so specific that when your ideal client lands on it, they feel like everyone else just kind of knows what they're doing, but you really know. Network with people who refer to therapists that see your ideal client. So maybe a functional medicine doctor, maybe a massage therapist. If you love public speaking, maybe go speak to the Junior League about stacking priorities. Maybe go talk to the local Women Dentist Association about stress and bruxism in women. And they'll refer patients, but they'll also come and see you themselves too. If you hate public speaking, maybe a deep dive into SEO, write blog posts or make videos that your ideal client finds interesting and helpful, and SEO those with keywords that your clients search. There are tons of ways to market. Remember, I only want you to do 5, some that are set it and forget it, like maybe a well-honed online listing, and some that are more dynamic, like networking or social media. Today's free worksheet is Common Marketing Strategies for Therapists. It helps you see that you can choose from to flesh out your marketing strategy, that it actually needs to be a fleshed out strategy and not 1 or 2 things to try to get clients. The link for that is going to be in the caption. I hope that you'll have a really great week, and I will see you soon.